So apparently you're a bunch of fire medics. As you walk into the fire station for the start of your shift, you hear the front doorbell. When you answer the door, you find a neighborhood child who tells you that while he was waiting across the street for the school bus, he saw a man lying in the alleyway. Yeah. You alert your crew, grab a first-in bag, and follow the child who takes you directly to the man. As you approach, you see him lying in the alley between two houses, curled into a ball and holding his left ankle. He appears dirty, disheveled, and pale. You recognize him as a homeless man, Mr. Stan Campbell, whom you have seen on previous calls involving drugs, alcohol, and assaultive behavior. Class act. When you ask him what is wrong, he mutters something about tripping and hurting his leg. There he is, right there.
Oh, yeah. That's my crack, Billy.
Your appearance, you see it, eyes closed, fetal position. That was him on a good day, not today. He's responsive to verbal stimuli, clear airways, moaning, rapid and shallow breathing, rapid radial pulse. Immediate concerns. Always scene safety. Given your previous exposure to the patients and you know that he may be a dangerous man, you need to try to get police out there with you. What about the child? You got a child that's now kind of a tag-along with you. Cool, I'm an explorer. Let me take care of this guy with you. Because I guarantee you that child ain't going to just go back and stand on the at the school bus stop. Probably so. What do? Call the HR. You going to get the kid taken from his parents for being a good citizen? We're going to try to let him get in touch with his parents, right?
Could not be started on.
In all honesty,
He probably has a cell phone.
probably does.
This day and age.
He's probably already texted him, probably sent a selfie with that guy.
On Twitter.
Yep. Hashtag homeless guy in the alley. But you gotta watch out for that kid now, right? So we need to try to get in touch with his parents. What about this patient immediately grabs your attention? Some of his assessment findings. Alright? Dirty, his appearance. First impressions last a lifetime. You already know this guy from his past experiences. You find him in a fetal position. A lot of times that can indicate what? Yeah, some type of abdominal pain. How about just the fact that he's real lethargic, eyes are closed, just moaning? So what are your treatment priorities? ABCs as always. Life-threatening conditions. Patient who exhibits a decreased level of consciousness, tachycardia, and tachypnea should be treated swiftly and appropriately. Got the parents. He's disappointed and has to go to school. Police officers, they're there. They're ready to assist. Patient tells you he's unsure exactly how he ended up in the alley, but remembers having an argument with a friend. In fact, he cannot tell you where he is other than the name of the town. He does not know current day, month, or year. Based on past experiences with him, this is very unusual. Do your primary assessment, rapid trauma exam, and find he's guarding his abdomen. You see bruising to his right upper quadrant, extending from his anterior axillary line across his left upper quadrant, midclavicular line. He also has noticeable swelling and deformity of his left ankle. Alright, so let's try to get a visual here before we move on. Sorry, I got to take the credit away, Asa. Asa was picking his brain. You are? I actually had it taped together, so I'm assuming that's the... Alright. See bruising to his right upper quadrant, right? Extending from his anterior axillary line, right there, across his left upper quadrant, so it's going from here to to mid-clavicular line. So he's pretty much just got a huge thing right here, right? Or it would be down just a little bit, right? Alright? Then he's also got noticeable swelling and deformity to his left ankle. Sorry, I had to grab your veno there. Alright. Verbal, oriented only to person in place. That's 5 minutes later. Cool, pale, and slightly moist is his skin. To tachycardia. Tachycardic. Breathing 40 breaths per minute, 96% while receiving 15 liters oxygen via non-breathing mask. So, a couple things that might be going into these, and we'll talk about them, but I just want to see what you think. Why may he be expressing or showing these vital signs? Alright, so he may have some diaphragmatic injury. Alright. Y'all said shock. From what? Or where is he bleeding? If it didn't notice anything about bleeding. Alright, internal bleeding. So he could have internal bleeding, inflammation. So that in itself, you're going to start getting some of these vital signs. On top of that, right upper quadrant, left upper quadrant, right up under the diaphragm. What's going to happen to the diaphragm? It's going to compress up, right? So the signs we just talked about. Anything else that it may indicate to you? I'm probably going with what I found, and probably my gut is going to be that it's his gut, right? He's bleeding into his gut. What does abdominal guarding usually indicate? We already kind of talked about it. Do we walk around like this all day long? It's almost the body's way of trying to naturally splint, right? What does a fetal position do? Right. When I'm standing upright or laying flat, my abdominal muscles, I do have abdominal muscles, I can promise. They are what? Contracted, right? So if we can, that's just, again, the body's natural response to abdominal pain. We're going to try to take off that tension on the abdominal muscles. So is this condition an early or late finding? 130 beats per minute, blood pressure 102, 40 breaths per minute, cool, pale, slightly moist. I mean, that's pretty profound tachycardia. That blood pressure is pretty low. Yeah. Probably not in irreversible yet, but we're entering into the early stages at least of what? Decompensation. Given the unclear events surrounding this situation, you take spinal precautions with the patient, apply high-flow supplemental oxygen, and establish a large bore IV en route to the ED. You are very concerned about internal bleeding and organ damage associated with this apparent blunt trauma and initiate immediate transport to the local trauma center. En route to the hospital, you start a second large bore IV and splint his left ankle. Normal saline, wide open, frequent reassessment. You place him on a cardiac monitor. Chief complaint remains pain in his left leg. Pretty interesting, right? We've got signs and symptoms of shock due to blunt trauma, but he's fixated on his leg. Almost goes to show you that musculoskeletal injuries are very painful and can actually steal the thunder of the more severe injuries, right? It's very hard when you're trying to take care of somebody to focus on the life-threatening stuff when they're screaming about their musculoskeletal injury, because I guarantee you, at one point or another, everybody in here has had some type of musculoskeletal injury, sprain, strain, broken bone, avulsion, or something. You know it hurts, right? So 10 minutes later, still only oriented to person in place, cool, pale, slightly moist, same vital signs, except he's breathing a little bit faster now. What are we going to be looking for? What are we going to be needing to pay attention to? Why do you think that his pulse and blood pressure are probably normalizing off, or at least hanging out in the same place? Just a second. Because we're giving him fluids, right? We're giving him fluids. We're volume replacing. Now, just because he's got a blood pressure of 102/60 and a heart rate of 130 to get that cardiac output, his respiratory rate going up indicates that maybe we've got a good blood pressure, but we're not oxygenating as well, right? Or we're increasing the intra-abdominal pressure, right? Yes, sir.
How come nobody started tagging him? Why was that in the 42?
Maybe they're getting there. I don't know. Would you bag in this situation? Like if this was you? Yeah?
If he would allow you to.
Probably would too. Alright. So rapid transport and interventions. Why is that important? He's already decompensating, right? How are we going to fix internal bleeding? We're not, right? Patient's chief complaint and primary problems always identical. We just hit on this. What's his chief complaint? His legs hurting him, right? That's where good assessment skills, good critical thinking comes in, because is that leg a priority? No, it's not. Not at this point. Unless it's an open bleed. Which organs are at risk for injury? From where we found the indication that he's been injured bad. Alright, kind of a lot of the good stuff, right? We got gallbladder, we got liver. Hard enough, it could have gotten what? Kidneys. Alright. We got what on this side? We got the pancreas that kind of hangs out the left side, kind of goes over to the right side. We've got our spleen. What also do we have that comes up and goes back down? The transverse colon, right? We've got the aorta. So there's a lot of goods there that could be injured bad. Upon your arrival to the hospital, the patient's condition is immediately evaluated and he is taken to surgery. You later learn that he had significant blood loss from liver lax and ruptured spleen. He also has multiple fractures of his left distal tibia and fibula. He wasn't lying to you, it did hurt. As a result of several blows from a baseball bat, this joker got beat down. Age and pre-existing medical problems make traumatic injuries worse. How?
Because they're already suffering from those problems, so a traumatic injury just piles on top of it.
Alright, so a lot of times with age, we'll just look at age. Osteoporosis, you do have those degenerative diseases that occur with age. Also, as a person gets older, muscle mass is replaced with what in the gut? Fat. Which one's more dense? Which one's going to cause more protection? Muscle mass, right? So, especially blunt, penetrating things like that to the abdomen, you don't have near the protection as you get older. Alright? Also, geriatric patients don't have the same compensatory mechanisms. Extremes of age, disease processes such as diabetes, heart conditions, and high blood pressure, along with their accompanying medicines, can mask signs and symptoms in otherwise healthy patients. Also, mechanisms of injury and their associated damage can change with age. Children who are struck by cars have different injury patterns than those of adults. Older patients on beta blockers are not able to compensate for blood loss with increased heart rates in the same way younger patients can. For this reason, whenever possible, you should obtain trauma patients' medical history, including medications and allergies. So how does a beta blocker work? It blocks the beta receptors, right? What role do the beta receptors have in shock? What's stimulated in shock?
It has a positive
So it stimulates one part of the autonomic nervous system, which would be the sympathetic nervous system. Beta adrenergic, adrenergic receptors are what are activated to do what? Increase what? Heart rate, right? So if you got a beta blocker, you've kind of blunted the effects of your compensatory mechanisms, right? All right, any questions?